Welcome to the COVID-19 Compliance Officer course brought to you by OHSS Savvy Consulting. In Session 4, we will discuss the legal and human resource considerations, as well as the COVID-19 reinduction, and finally, a recap of this course. Here are a few legal considerations. The objectives of the guideline of the National Department of Health is to effectively collect, collate, and analyze workplace data on clinical screening, vulnerable status of employees, COVID-19 infections and contacts to identify hotspots at an early stage so as to prevent further escalation of the pandemic. The guideline has been developed to provide clarity to the relevant stakeholders about the data and data reporting process as required by the above legislation, and to streamline the reporting tasks of employers. What is the purpose of the Occupational Health Surveillance System? It is to develop a framework for a COVID-19 surveillance model for monitoring workers in various economic sectors, both in the public and private sectors. It is also there to provide in-depth understanding and strategic insight of the COVID-19 infection spectrum in the South African workforce through dynamic data analytics and visualization into all phases. This would include symptom screening, testing, vulnerable employees, contact tracing within the workplace, return to work and health outcomes of the pandemic. Early identification of sectors or companies and occupational groups at high risk of infection so as to inform appropriate interventions. This could include policies, programs, as well as additional resources. To evaluate the impact of the COVID-19 interventions in the workplace, to determine the human resource and economic impact of COVID-19 on the various sectors, to provide regular updates on the trajectory of the pandemic in various economic sectors nationally, and the identification of key scientific questions requiring further investigation. What is the scope of application of the Occupational Health Surveillance System? All workplaces are required to submit information on those employees who test positive as per the guidelines. All employers in the sectors with a threshold number of employees referred to in the regulations are to submit the various categories of data detailed below. What are the categories of data? Vulnerable worker data, daily symptom screening data, COVID-19 testing data, high exposure risk workplace contact tracing, post-infection outcome and return to work data. Let us look at these categories of data in more detail. Vulnerable worker data. All employers are legally required to identify those employees who are considered to be vulnerable for the more severe outcomes of the COVID-19 infection. Since this is a key component of the screening of workers, this data must be submitted by employers. The vulnerability status of each worker that is submitted is not dependent on the availability of detailed medical information being available to the employer. This once-off submission is submitted when collected by the workplace, and any subsequent occasion where new appointments are made, or an employee's status requires updating. The data required are listed in Table 1 in the appendix templates that were emailed to you. Daily symptom screening data. All employers are legally required to screen all employees entering their work premises on a daily basis. This screening must be based on the prescribed set of symptoms as has been defined by the National Institute of Communicable Diseases to determine those persons likely to be presenting with a COVID-19 infection. and therefore should be referred for further assessment. This daily collected data must be submitted by employers for those employees that are symptomatic. The data must be submitted on a weekly basis should there be symptomatic workers recorded during the calendar week. The submission should occur before Tuesday for the previous calendar week, commencing on Sunday. The data required are listed in Table 2 in the appendix templates. COVID-19 testing data. Based on their daily symptom screening or on their employees' representation to their health provider, employees are referred to health providers or health laboratories for testing for the presence of COVID-19 virus. In terms of managing the pandemic in the workplace, the employer is expected to be notified of the results of the tests. The results of the laboratory tests of all employees who test positive must be submitted by employers upon receiving the results of such tests. In addition, employers need to submit details in Template 2 for such individuals. This submission occurs only when an employee tests positive for COVID-19 and should be submitted on a weekly basis should there be positive workers identified during the calendar week. The data required are listed in Table 3 in the appendix templates. High exposure risk, workplace contact tracing. When an employee tests positive within the workplace, all those in contact must, as per the Department of Employment and Labor Direction, be assessed for a high risk or low risk of exposure. A high risk of exposure is defined as being in close proximity or less than 1 meter for a prolonged period of time, more than 15 minutes, without the use of personal protective equipment and/or a face mask. Those employees with such high risk of exposure are expected to be placed in quarantine. The total number of employees placed in quarantine as a result of the high-risk exposure should be submitted on a weekly basis should there be positive worker or workers identified during the calendar week. Individual details of the high exposure risk contact need to be reported. The data required is included in Table 3 in the appendix templates. Post-infection outcome and return to work data. Recovery from the infection will vary based on vulnerability and other risk factors. Understanding the outcomes of the infection among employees provides critical information. All employers who indicate employees have tested positive must submit information about the outcome of the infection and the return to work decision. No confidential clinical information is required. This data must be submitted once, only when the employee returns to work. The data required are listed in Table 4 in the appendix templates. In collecting this information from their employees, employers are obligated to inform employees about the submission of this data to the department. All the above categories of data must be submitted to the OHSS portal at the National Institute of Occupational Health, the statutory entity designated by the Department of Health for the collection, analysis, and reporting of the data from workplaces. This clause does not remove the legal obligations by employers to report COVID-19 related information to specific government departments. All data must be submitted via one of 3 online platforms. In instances where employers are already using electronic applications, they can submit data to the National Institute of Occupational Health data lake either through CSV data files and/or secure API transfer. Companies are also welcome to contact the National Institute of Occupational Health at OHS Workplace at nioh.ac.za to obtain further information about already developed software packages that could be used for this purpose. Employers may choose to use the Center for Science and Industrial Research (CMOR) software that has been developed with public funding and freely available to use. Organizations can use the CMOR mobile and/or web platform to submit data. The data collected via CMOR are transferred to the National Institute for Occupational Health Data Lake. Employers may contact the National Institute of Occupational Health at OHS Workplace at nioh.ac.za if they are interested in this service. The templates referred to in this guideline are already built into this application. Protection of personal information. All data submitted under these guidelines strictly adheres to the Protection of Personal Information Act and follows the guidance note on the processing of personal information in the management and containment of COVID-19 pandemic in terms of POPIA by the Information Regulator. The National Institute of Occupational Health will be accountable for processing and storing personal information of subjects in a responsible, legal, and appropriate manner. POPI is a legal requirement. All employees must be made aware by the employer that their information is being submitted to the National Institute for Occupational Health. NIOH will receive identifiable data. Once received, each employee will immediately be assigned a unique identifier, which will permit linkages across the different data categories. Once this is done, all identification data is immediately delinked from submitted data. This data will be kept as per the following guidelines. Personal data for 6 weeks as described by the COGTA Regulations 811C. Processed data and reports to be kept as long as required by legislation governing the collection of this data. The Department will observe the highest standards of data storage, management, and security as stipulated in the regulations of the Disaster Management Act, the Protection of Personal Information Act, and other international standards. Technical and organizational measures will be in place to prevent the loss or damage to or unauthorized access of personal information. All personal information will be confidential and will only be disclosed if required to do so by law. What document are we referring to with all of these annexures? It is the guideline on the submission of COVID-19 related health data from the workplaces to the National Department of Health. This guideline document is prepared by the OHS Workstream on Surveillance of Workers COVID-19 Response version 4 of 27 November 2020. Never forget the reinduction program of COVID-19 information. When should you reinduct employees on the COVID-19 Compliance Management Plan and Protocols? Whenever a positive case has been confirmed for your company, after an incident or accident relating to COVID-19, when new legislation has come out from the National Institute of Communicable Diseases as well as the National Department of Health, or when we start a new year after the holiday season. The reinduction of COVID-19 materials can occur whenever an employer feels that strict adherence to the C19 OHS regulations or the company's policies and procedures are not being adequately adhered to. Let's recap. As a COVID-19 compliance officer, you should know and understand your company's COVID-19 plan, risk assessment, and procedures for handling incidents or any other issues. Employers are required to provide, ensure adherence to, and enforce any measures as required by the directives in an effort to prevent the spread of COVID-19. Employees are obligated to adhere to these and company-specific directives and protocols. As an appointed COVID-19 compliance officer, you are to keep up to date with government guidelines and changes to directives on websites provided. Please see the www.sacoronavirus.co.za for more information. Being a COVID-19 compliance officer means that you must be able to work cooperatively with your employer and employees to ensure adherence to the protocols set out by the directives and address any issue that may arise in the interest of health and safety. Let's recap. Where can you find resources? Request a link to the OHSS Dropbox folder, which will have resources and templates available for you. Alternatively, visit the following websites: sacoronavirus.co.za, nicd.ac.za, health.gov.za, or who.org. Employers are required to provide, ensure adherence to, and enforce any measures as required by the directives in an effort to prevent the spread of COVID-19. As a compliance officer, you are required to provide support in a monitoring and implementation area of responsibility, and all employees are obligated to adhere to these and company-specific directives and protocols on COVID-19 prevention. Risk assessments must be carried out continually and checked for effectiveness when there is a positive COVID case. You may need to attend a HIRA course or hazard identification and risk assessment to effectively conduct a risk assessment. For assistance with this, please contact us on info@ohss.co.za. For additional resources, please make use of the CMOR online reporting program for all screening, positive, or vulnerable cases. To get more information, please reach out to us or locate the information on the NICD or NDOH websites. Let's recap. Changes to normal working routines will include physical distancing, workplace or work time adaptation, personal protective equipment, facilities, screening, access systems, client and visitor management, as well as attendance and absence management. Employers are required to ensure protocols are adhered to by employees and visitors by verbal and non-verbal means. Employees must have a routine of COVID prevention protocols such as hand washing, disinfection, and sanitization. As a COVID-19 compliance officer, you are to supervise and monitor the controls in place to ensure adherence to the C19 OHS regulations and keep up to date with what additional protocols may be needed by checking the National Institute for Communicable Diseases or the National Department of Health websites. A COVID-19 compliance officer should check all aspects of the COVID-19 management plan to ensure all areas are covered. Keep a good schedule and use technology to your advantage by ensuring you are reminded day by day of what is needed. Congratulations! You have completed the COVID-19 Compliance Officers course.